All right, today we're going to be talking about the capacity step of the strategic prevention framework and looking at how some of those principles can help guide us through the community health assessment process. So, community health assessment is a systematic process involving the community to identify and analyze community health needs and assets, prioritize those needs, and then implement a plan to address significant unmet needs. Community health assessment process is centered around community engagement. SAMHSA says the purpose of the capacity step is to build and mobilize local resources and determine the community's readiness to address priority substance misuse problems. Local resources needed to establish and maintain a prevention system include both human and structural resources, as well as people with motivation and willingness to address these problems. 3 strategies for building local capacity include engaging diverse community stakeholders, developing and strengthening a prevention team, and raising community awareness about the issue. So as you can see, community engagement is vital to both of these concepts. We're going to take a look at how these principles can help us through the CHA process by discussing steps 2 and 6 from the community health assessment. Step 2 of the community health assessment is to identify and engage stakeholders. This step is heavily associated with capacity, but should be a focus of your work throughout the entire CHA process. Here are some examples from the state's perspective. The stakeholders that they decided to involve in the CHA process, as well as groups they formed, and how they will promote a joint sense of ownership. The state examples are a little different as they are not on the ground in a local community like many of you are, but nonetheless, you can see how they are engaging with stakeholders on both ends, both involving them in assessment, as well as making sure to share results with them. So here are some different community sectors to consider when assessing current capacity or looking to build and mobilize local resources and community readiness. Take a look at the sectors you see listed here and think about where you have connections and resources and where you may be lacking connections and resources. It can be incredibly insightful to physically map out community assets to show where human, physical, informational, political, and existing intervention resources exist. So now let's take a look at the capacity check-in worksheet that may be helpful here. It's broken down by these sectors, including an additional space for other, and it has space for you to fill out partners, contacts, and resources that you have access to in each of those sectors. Think of this as a way to find out what areas are strengths for your coalition and what areas have gaps. This will be useful information when planning and selecting appropriate evidence-based interventions, as well as for gaining an understanding of your coalition's capabilities and limitations. Now, when developing your prevention team, there are 3 key things that need to be taken into consideration. First, you need to be deliberate, meaning that you should be clear in your communication of the purpose of the collaboration, how goals will be met, and the responsibilities of everyone involved. Clear understanding and effective communication are vital components of collaborative success. You also need to focus on building prevention knowledge and skills so that the team may develop a better understanding of the problem and effective solutions. Many of the stakeholders may have little to no experience in the prevention world, and even those with experience may not be familiar with evidence-based interventions and the reasoning that goes into them. It is important to build these skills and knowledge to ensure your team is all on the same page while building capacity and raising community awareness. Monitoring and improving group structures and processes on an ongoing basis as needed is also important. Discuss and codify aspects like leadership, decision-making, task distribution, conflict resolution, and communication out with the broader community. Engaging stakeholders is a continuous process, and they need to have a clear understanding of the goals, methods, reasoning, and their role. Group structures and processes should evolve and adapt as needed. Now, here are some common strategies to engage stakeholders, as well as to increase the participation level of already engaged stakeholders. Capacity building can be difficult, and there is no cookie-cutter method for engaging stakeholders universally. This is why community engagement is at the center of the CHA and can be viewed as an ongoing, constant process. Doing some form of capacity check-in is recommended on an ongoing basis so that you can identify strengths and gaps in your team and come up with ways to utilize those strengths and fill those gaps. Prevention is complex work that requires energy, expertise, and experience from a diverse array of partners, all working together across disciplines. Involving community members in planning, implementation, and evaluation demonstrates respect for the people that you are serving and increases the odds that prevention services are meeting genuine needs, being built on strengths, and producing positive outcomes. Lisa had shared an example related to asking partners to contact their partners about a time when she was working with coalitions and they were looking for a contact in the faith community. One of the coalitions had a brother-in-law who was a local pastor and had good ties to many in the faith community. That person reached out to their brother-in-law and was able to establish a connection into that sector that wasn't previously there. And the brother-in-law put those coalitions in touch with many other pastors and members of the faith community, helping expand their reach and build their capacity. So now if we look at step 6 from the CHA, it is to document and communicate results. Documenting results of your assessment is useful because it shows your work for how you identified the priority health issues and disparities within your community. It can also serve as a reference point for future assessments. Just as important as documenting your results is figuring out how to effectively share and communicate those results with stakeholders in the community. Here are some examples from the state's perspective on how they documented the results of their CHA and how they will share those results out. So they documented their different assessment findings through the grant narrative, the disparity impact statement, the needs assessment report, the strategic plan, and the annual evaluation report. Now, those results will be shared out through quarterly reports, evaluation reports, group meetings, information through Prevention Network, and uploaded into the federal reporting system. What should be documented? You want your CHA report to include the following information. Keep in mind these are not requirements for what should be submitted to us, but rather guidelines for the type of information that you want to make sure is included in the results of your assessment. You want to include the underserved, low-income, and minority populations that are represented. The people and organizations that were involved in data collection and analysis. The service area or community served. A description of the processes and methods. Identification of all organizations that collaborated. A description of how you solicited and integrated input from the community. The process that was used for prioritizing your needs. The list and description of those priority health needs. Available resources and strategic measures to address those needs. And an evaluation of the impact of the strategies you implemented. This may seem like a lot, But you should notice that a lot of these things are tied to what was worked on and identified during steps 1 through 5 of the CHA. So think of this as more of a checklist to ensure that all of the work you have already done is being included and documented. Now that you have your results documented, the next step is to present those results to stakeholders and the community. Data can be challenging for stakeholders and community members to interpret, and it is important that you figure out a way to translate that data analysis and present it in a way that is easily understood and logical. So here are some tips for presenting data. You're going to want to organize it with clear headings and labels, and utilize graphs, maps, photos, tables, and charts when necessary or applicable. Select appropriate graphics and visualizations, and identify ways to present the data that highlights health disparities. Make sure to use descriptive labels on all graphs and tables, and tell a story with the data. This last step is very important. Telling a story with the data is how we can communicate our findings and sell them to different stakeholders and members of the community. Many prevention professionals are exceptionally skilled at storytelling and conveying their message in a way that connects emotionally. Figuring out how to take the evidence, the numbers and stats that revealed your health issues and disparities, and present that to stakeholders and community members in a way that they can digest and understand is vital. It is similar to marketing, as you have to figure out how to repackage your message so it lands how you intend it to, and that can vary depending on the different sectors that you're engaging with. What is the most effective way to sell that sector on your work? So here we have some different methods for sharing your results and spreading the information throughout your community. Sharing your results in an effective manner is directly related to raising community awareness, which in turn increases readiness. We want our communities to be aware of priority health issues, to understand why it is an issue, and to be ready to act to solve the issue. Steps 2 and 6 of the community health assessment are directly related to these goals and build upon the assessment work we have already done so that we can effectively address the issues our community is faced with. Some different ways you can publicize your community health assessment results are through websites, social media accounts, press releases, email blasts, listservs, or public meetings and presentations. And you also want to consider how you will track how many individuals have accessed your CHA results through these different forms of distribution so you know what is most effective. So now we'll touch on the SPF guiding principles of cultural competence and sustainability, and once again emphasize that they are not separate steps or afterthoughts, but guiding principles that need to be integrated into each step of the strategic prevention framework. Cultural competence can be integrated by building the knowledge, resources, and readiness of prevention practitioners and community members to address disparities, as well as to provide culturally and linguistically appropriate services. Making sure that practitioners understand the role of cultural competence in their work overall and the unique needs of those subpopulations experiencing disparities. Developing new partnerships that will help engage members of these groups in prevention efforts. Sustainability can be incorporated throughout the capacity step through intentional capacity building at all levels, helping to ensure that successful programs are sustained within a larger community context and therefore less vulnerable to local budgetary and political fluctuations. Effective capacity building increases in an organization or community's ability to respond to a changing issue with innovative solutions. Building capacity also involves promoting public awareness and support for evidence-based prevention and engaging partners and cultivating champions who will be vital to the success and sustainability of local prevention efforts. So again, we want to make sure we're thinking about cultural competence and sustainability throughout the process, doing these things to ensure that we are incorporating it into our capacity work. That's going to wrap up our presentation today. Next time, we'll be touching on the planning step of the strategic prevention framework. Thanks.